Presentation on problems with medication administration.
Hello, I'm Menchi.
Hello, I'm Bindu.
Today we're going to talk about penicillin.
Penicillins are a group of antibiotics used to treat a large range of bacterial infections. They are derived from Penicillium fungi. The penicillins were the first antibacterial drugs used by doctors, and they attack a wide range of bacteria. Penicillin was discovered by Dr. Fleming by accident in 1928. The story goes that he returned to his laboratory one day to find a petri dish with its lid removed that had Staphylococcus bacteria growing on it. The dish had become contaminated by blue-green mold. He noticed that there was a clear ring surrounding the mold. He concluded that the mold had secreted something that inhibited bacterial growth. This clear zone immediately around the mold was later identified as a rare strain of Penicillium noctidum, but not until 1940, penicillin was successfully isolated by Dr. Flory and Dr. Chain, and mass production of penicillin begins. There are different classes of penicillins, such as the penicillin, aminopenicillins, penicillinase-resistant penicillins, and anti-pseudomonas penicillins. Each class of penicillin works better against certain bacteria than others. In this presentation, we are going to look at the class of penicillin. Penicillin comes in different forms. The intravenous penicillin, such as penicillin G, the oral form of penicillin, for example, penicillin V, and the intramuscular penicillin, such as procaine penicillin and benzathine penicillin. Here is the monograph of the benzathine penicillin, and it is to be administered intramuscularly. The benzathine penicillin is indicated for streptococcal and venereal infections, as well as the prophylaxis of rheumatic fever, etc.
Now let us see the problems with the administration of penicillin. One of the problems with the administration of intramuscular penicillin is that there were reports of using intramuscular penicillin for intravenous use inadvertently. This may lead to cardiorespiratory arrest and death. Another problem with penicillin administration is penicillin allergy. Mild to moderate allergic reactions are common. Symptoms include hives, tissue swelling under the skin, throat tightness, wheezing, coughing, trouble breathing, etc. A less common but more serious sudden onset allergic reaction to penicillin is anaphylaxis, which occurs in highly sensitive patients and can be deadly. Anaphylaxis needs immediate attention like epinephrine therapy. Another problem with the administration of penicillin is overdose. The usual dose is once a week for 1 to 3 weeks, that is 1.2 million units intramuscular. Overdose symptoms include nausea, vomiting, stomach pain, diarrhea, neuromuscular hyperirritability or convulsive seizures, encephalopathy, coma, and hyperkalemia, especially for patients with renal insufficiency. Some of the drugs should be avoided while taking penicillin. Examples are oral contraceptives containing estrogen may not work properly with penicillin. Tetracycline, a bacteriostatic antibiotic, may antagonize the bactericidal effect of penicillin. So the concurrent use of these drugs should be avoided. The rate of excretion of the penicillins is decreased by the concomitant administration of probenicide. Probenicide prolongs as well as increases the blood levels of penicillin. Important step before the administration of penicillin is testing and diagnosis of penicillin allergy. It includes the history of patient about a prior allergic reaction to penicillin. Skin test. In this, a weakened form of the drug is injected, and if there is an allergic reaction, it will cause a red, itchy, raised bump. Next one is the graded drug challenge. 4 to 5 doses of the suspect penicillin is given, starting with a small dose and increasing to the therapeutic dose. If no reaction is reported, then no allergy.
Penicillin was the first antibiotic to be used medically. There are different types of penicillin for different medical applications. The major problem in penicillin administration is allergic reaction, where most symptoms are mild to moderate, and less than 1% of people are dangerously allergic to penicillin. However, screening of penicillin allergy prior to administration is still important.
created using Powtoon.